Hi, my name is Grace, and today I'll be demonstrating how to prepare and administer your Tirzepatide solution at home. Make sure you've washed your hands with soap and water before beginning. In the mail, you will have received your 3 milliliter vial of Tirzepatide, your vial of bacteriostatic water, a 5 milliliter syringe paired with a 21 gauge needle to reconstitute, along with 1 cc insulin syringes and alcohol prep pads to administer. We're going to begin by removing the plastic caps from both vials. Gently sanitize each rubber diaphragm with an alcohol prep pad and allow to dry. We're going to begin by attaching our needle to our syringe. Then, using our sterile 5 milliliter syringe, we're going to pull the plunger back to the 3 milliliter mark. Once you've uncapped your needle, we're going to introduce it into our bacteriostatic water vial at a 45-degree angle, bevel up, before going in vertically. Then, decompress the plunger completely. Holding the bacteriostatic vial in one hand and the syringe in the other, we're going to gently pull the plunger and draw up slightly more than 3 milliliters of bacteriostatic water. We're then going to invert our vial once again and take out the needle. We are then going to introduce the water into our vial of active ingredient. As this is solely a demonstration, please keep in mind that my vial does not have any of the active ingredient. We're going to inject the 3 milliliters of water into our vial, pointing the needle towards the side wall. Then, after removing the syringe, we're going to recap the needle and dispose of it into an appropriate sharps container, such as an empty milk jug. You will then gently swirl the vial until all contents have gone into a clear solution. Now we're going to administer the prepared solution. Gently sanitize the vial opening with 1 swipe of an alcohol prep pad and allow to dry. We're then going to pull the plunger of our 1 cc insulin syringe to our dose line, pulling air into the syringe. For today's demonstration, I will be pulling up 25 units of the prepared solution. After uncapping our needle, we're going to insert the syringe through the rubber vial diaphragm and inject the vial with air from the syringe. With the syringe still inserted, turn the vial upside down and slowly withdraw your dose. Make sure there is no more air left in the syringe, only liquid. We are now going to sanitize the injection site and allow to dry. Then, pinching the site, we're going to inject the dose into it and slowly push the plunger down. Once the dose has been injected, remove the needle. If blood appears, you may press lightly with gauze. Lastly, just as we did earlier, we're going to recap our needle and properly dispose of our syringe. Once you've administered, place your medication into the fridge to store. Make sure to discard the medication after 60 days.